So, this is a phase 3 trial of a drug called semaglutide, popularly known as Ozempic, that is commonly used for patients with diabetes and obesity. The focus of this study was really to see whether it affects one of the common conditions that is associated with obesity and diabetes, which is fatty liver disease, particularly a form called steatohepatitis, which can lead to scarring of the liver and even cirrhosis and liver cancer. The study is divided into two parts: an initial part where we look at the liver under the microscope and see whether things are beginning to look better. And the second part is when we continue to follow patients to see if actual patient outcomes are improved. So the study report that we will present really focuses on the first part, where we show that the liver actually starts looking substantially better under the microscope in these patients. So this is a study population of people who already had started scarring down their liver. And what we show is that this drug can very effectively reverse the scarring as well as the fat and injury in the liver. So this is incredibly exciting news, because many of our patients who have this condition are also obese and have diabetes and are at risk for heart disease as well. So this molecule, this drug, has already been shown to be beneficial for obesity, diabetes, heart disease, etc. Now we can add liver disease to that list. So imagine one drug to treat all of these different conditions. So this is a major step forward in the field, and it provides patients additional choices when we think about treating fatty liver disease. The studies for approval for this particular disease are generally considered in two time frames. First, in the short time frame, to see if the liver starts looking better under the microscope, because that occurs before actually patient outcomes occur. NASH, as this condition is called, progresses over many years before people get cirrhosis, and they get cirrhosis-related complications, which often require a transplant. In the first part, within a year or so, if we can show that the liver is looking better, then that dramatically increases the likelihood that this will translate into better patient outcomes. So the approval of these type of drugs is contingent on demonstrating in this early phase a pre-specified amount of improvement in what the liver looks like under the microscope. And we exceeded that threshold. So this is very exciting for people like me who spent 20, 30 years taking care of patients with this condition. This is hope. And this gives us why we've been doing this for so long. It's incredibly gratifying to see the results and to be able to have something hopefully down the road that will get approved. And then we will be able to offer this to all our patients who need it. Well, imagine this, that this condition perks along silently, and then one day it's suddenly discovered that you have cirrhosis, or even worse, you have cirrhosis with a cancer. At that point, you're suddenly faced with a life-changing piece of information, and many of these patients already have underlying heart disease, etc., which make them very high risk for liver transplant. So transplant is not an option for many of these patients. So few lucky people can be saved with a liver transplant, but for the rest, it becomes a death sentence. And what studies like this and drugs like this mean is that we can identify the patients early, we can treat them early, and we can prevent that scenario in many patients. Maybe not in 100%, but this is a very active field. There are a lot of drugs coming behind this, and they all look very, very promising. And so we're very, very hopeful that we really think we're at this point in time where we're getting to that tipping point, where for the last 20 years, we had almost nothing to offer. Last year, as you know, the first drug was conditionally approved. It's called resmetirom. And now we have very exciting positive data from this study, which hopefully will lead to an approval. Only time will tell. But behind it are drugs that are looking progressively better. So this is very, very exciting for everybody in this space.